Everyone matters.
Everyone matters.
People think that community health centers are about doctors and sore throats and getting better, but it is so much more than that.
Community health centers, they go where others fear to tread, and I have enormous admiration as a result.
I don't see a private medical office working with people in a community garden, create a youth center, create walk club for people, working in mental health with group support, having a session how to understand the heart disease and things like that, do some health promotion and health prevention. And also working in partnerships with the food bank, legal aids and things like that. This is basically what we are doing every day.
Oh my.
The greatest, smartest doctor will not be able to get the pulse of the community. So the notion of elected people who are from the community, of the community, for the community, by the community, and the doctors working in this environment is, to me, one of the great things about the community health centers in Ontario and elsewhere. It should be promoted and enriched.
What I'm trying to say,
Every community.
Every family.
Direction. Who said nothing changes underneath the head. Turn on the light. The age of darkness.
Nice to meet you. Thanks, sir. You're welcome.
Those old ideas. And maybe we can learn to fly.
The time has now come when medical care generally has become so costly and is likely to become more costly, so that the expense ought to be borne in part at least by society as a whole, rather than putting the entire burden on the individual who is so unfortunate as to be ill.
As a society, we can only be as healthy as each individual member. I think Tommy Douglas recognized the value in each individual.
I am concerned, as many people are, about Medicare, not with its fundamental principles, but with the problems which we knew would arise.
I remember hearing that speech, as he says by his own words, his biggest regret, that the second phase, 2 phases to Medicare. One phase, eliminate, if not eliminate, reduce the dollar as a barrier for the delivery of health care between the health care provider and the patient. And the second phase was to make sure that as a community and a concept of community delivery and health care delivery, we would be looking at all of those determinants which affect our health and the quality of our life long before we actually come into contact with the acute caregiver. There it is.
You can be healthy all you want, but if the community you work in is not healthy, it will have an effect. So this is where the magic, I would say, of a community health center comes into play. It is in the second stage of Medicare. All the work we are able to do because of the structure that we have to keep people and community healthy.
We have to pay attention to what's in front of us, and we have to react and serve what's in front of us. We can't sort of go by what we think is out there in terms of the illness of the population. We actually need to get into the communities and work with them. And that's what makes community health centers, I think, somewhat different than some of the other providers. We go and we set up programs for them in their community, near their homes. It's cost effective to do that because it doesn't involve brick and mortar. This involves brick and mortar, and we will do that if we need to. But I think it's important that we look at accessing clients in a variety of different ways, and that we go to where they are.
Go out into the communities, and I believe we make a big difference to the people that we see. That's the reason I like the job. When you go into the small communities, you really get a flavor of what the community is all about, You get to know people on a grassroots level. You get to know their likes, their dislikes, their fears. Some of our clients have never seen doctors for years and years. And when we keep coming each month, they know that we're reliable, they know they can depend upon us, and they know that we're not going to be judging them, that we want to help them.
They really appreciate what we do for them. Again, we see that in many ways. I mean, certainly how they treat us, the respect we receive, just their friendliness, and they tell us, you know, they miss us if we're not here. So the services we provide are wanted in these communities.
When they start to come to our center, we start to build the confidence with the people. You are a person. You have strength. We're going to work on your strength, and we're going to help you build your strength, because we have different providers with different ways of working. So in every aspect of your life, we will try to touch you, but we will try to give you the tools to go to the next steps.
I couldn't see the future. Life was too hard and I didn't know if I wanted to live anymore. And I went to the hospital, and when I went to the hospital, I did ask for some help in French, and I was turned around that it wasn't available. And a few days after, somebody from the center called me. I didn't think anybody cared. I didn't think that I would even get that help, so it was a lifeline.
We're standing at corner downtown Bourget. Behind me, the Bourgetel, which is a restaurant that closed down. 2 blocks down, there is the pharmacy where the family doctor was, and further down, the community health center.
For the first time ever, there was no doctor in Bourget. So people were kind of they didn't know what to do. To get medical services, they had to travel half an hour, 45 minutes to get some medical care. That's when we asked our MPP. We managed to get the executive director of the CHSC from Cornwall visit us at a citizens meeting, and at that first meeting there was well over 100 people that attended, so it showed the need and the interest of the people to get something going in Bourget.
It means for our communities, because we have five sites, 5 different communities, it means that wherever you are, you will have access to a community health center. And whatever your condition, your level of education, you're poor, you're rich, you're alone, you're a woman, you're gay or lesbian, you will have access to this service.
If this place didn't exist, I'd be on the streets. I wouldn't have my kids. I wouldn't have a house to live in. My life would be downright horrible.
We're come here because the Creator loves us, and it's an opportunity to engage in this journey. And if those have started in a difficult way, then it's for the rest of us to help them.
Everyone matters. It started just with walking through the door, looking around, seeing that this was a place that they could see themselves in, that they felt safe in, that they felt accepted in, and that they were not judged. And we lose that every day in our normal lives. But you get that when you walk through any of our doors and you see our people, and they know it.
It's not only primary care. It's not that you're sick, you go to the doctor, and that's how you cure yourself. It's preventing going to the doctor. And that has to do with if you feel isolated or not, if you have social connections or not. It's not only the social aspect of giving people access to affordable laundry, but to give a training program through an economic development piece that we provide laundry to clients at market price. And that way we're helping our clients through training programs and we also helping ourselves in become more self-sufficient.
It's a part of my life. I don't know how I'm going to be if I don't get the support from the community center. Probably suffer depression or financial a lot of problem. That's very important.
One of the major determinants of health is education. So what people in the community were finding was that there needs to be a way for this community health center, which has been so respected in this community, to address some of the greater, more systemic issues. Like, why do we have so many health issues in the community? And one of the reasons is because, well, there's barriers to students completing their high school education. Pathways was a result of consultations within the community, with community members, with community leaders, and thinking about what can we do to support these students to be the next leaders, the next doctors, nurses, social workers within the health center, and leaders beyond the community.
I think it would have been more difficult for me. I probably wouldn't have had the volunteer or internship opportunities, and I probably wouldn't have thought like I would get to med school. I think they made me feel good about myself that I could go into med school, and I think that's a positive feedback, and that's healthy.
The center is strategically located in downtown Cornwall. This is called the Old Town Mile.
You know, we chose the name Seaway Valley, so we didn't limit ourselves to Cornwall.
The board of directors represents our community, food bank, the seniors care, health care, mental health, addictions, and so on. Our board is made up of people helping people in our community.
We're looking to fill the need wherever the need is within the community.
Strong community partnerships, very strong community partnerships, integrating, no duplication because we're all working together.
It's a community effort. It's just not one person or a group of people. We've leaned on the entire community to try and get this up.
This area is all primary care through here.
Emerging CHC, getting your feedback about your interests and needs and health, your own health and what you'd like to see in Cornwall and area. As you walk in the building, there's a reception area here. Someone will greet you.
When a community health center is responsive to the community board is able to understand that responsibility and translate that into a governance experience, which really benefits everyone so that everybody's in touch with what's going on.
What if we created a new model? What if we said, we're going to do this from the start? What if we created a vision that goes something like, if we build it, they will come? Some of us have always looked at the health system and said, basically it's an illness treatment system. And, if we can get ahead of those illnesses, if we can understand the social determinants of health, then we can do so much more. And we're just really delighted to partner to bring some of those other programming opportunities together quicker with the launch of the CHC here.
I think it's a marvelous idea. I think it really works for the community, for people to be able to come to one place in their community and access a whole range of services. One of the things that we've managed to do is build up a lot of wonderful organizations, but they're all located in different places, so it's very hard for people to navigate that. Now they're all in one place together. People can come here, feel at home here, feel comfortable, get the health services they need, and also the social services. I think it's very, very exciting.
Here it is really very, very helpful. It's good for the community. Everyone matters.
The community health center, I think in 10 years, will be much more used because there will be hubs in small town and there will be hubs in neighborhood and big town, and most of the services will be, in terms of primary care, will be integrated in those CHCs.
I tell the Premier to make sure that everybody has access to a place like this. The more people like me from the public that gets help for the specific things they need, and they get the education, which we get from the center, it ends up that it's costing the government less money, just because You're getting the help when you need it, not when you're in major trouble.
A study was done as to the value of the community health center within the Ontario healthcare model, and we came out with flying colors. I would say no other model will ever be able to match this. You have to be set up as a community health center to be able to deliver that kind of result.
If I had any message at all to anybody in the community, I'd be saying to the community, continue to pursue the community health center approach, where you're a part of a community, everybody's a part of that community, doesn't matter what, and you're reaching out to make life better from them, from the housing straight through the health care. This is the great thing about the CHCs here in Ontario.
I'd like to see CHCs in every community across the province, because we have the ability to work very closely with communities and meet the need that's identified by the community, not necessarily by, the provider, but by the people we're serving.
My vision would be that we'd have 15 to 20 CHCs in every city. I mean, that would be wonderful, and creating that place of belonging that I believe is the way that people will heal.
Canadians still believe in what I call the notion of a shared destiny, where we have kind of a caring and sharing mentality. But I'm heartened every time that I come to a community health center, because it does indicate to me that that spirit of shared destiny, community, working together, tolerating, supporting each other is alive and well. Take care.
Thank you for inviting me to be here. May I wish you well in your deliberations now and in your performance to perfect Medicare in the future. Thank you very much.
Together.